Get started. My name's Christine. I'm a physical therapist here at Houston Physicians Hospital. One of my major specialties is treating Parkinson's. So we recently did a little special with Channel 13, so I thought I'd kick it off with the start of our symposium. It is featuring Dr. Bonnen, so there's a little bit of information on the deep brain stimulator.
Welcome to this edition. I'll check this out, Houston. I'm Kat Cosley, coming to you from the Houston Physicians Hospital in the Clear Lake area, where physicians here are doing amazing things in their Joint and Spine Solutions Center and with Parkinson's patients. Check this out. That's right, you are watching Parkinson's patients go a round or two in the boxing ring.
The whole goal with the treatment of Parkinson's is to improve patients' quality of life and maintain their autonomy and allow them to be as independent as possible.
Both neurosurgeon Dr. Greg Bonnen and the lead therapist know firsthand the toll Parkinson's can take on patients.
One of the tough parts about it is it's so insidious and gradually progressive that it makes it easy for you to, bit by bit, lose your ability to function. And then as people have a harder time with simple things like getting dressed, getting in and out of the bathroom, feeding themselves, they tend to become more reclusive. So just getting them to realize there are other people that have walked down this path and are walking down that path, and that there are things that can be done to help is just really critical.
That's why Houston Physicians Hospital offers a comprehensive approach to treatment.
It's very much a multidisciplinary or team effort, and sometimes they just need education and counseling, sometimes they need therapy, and if they need surgery, I can tell you that we have the best and the most sophisticated approach to this so that people have the safest and the best outcome that we can currently achieve.
Houston Physicians Hospital offers cutting-edge treatment like deep brain stimulation.
Can dramatically improve the symptoms. It's adjustable, so not only could it be turned down or stopped, but as Parkinson's slowly progresses, you can actually increase or adjust the parameters of the stimulation just in a simple office visit to account for changes in the progression of the Parkinson's. It can essentially put the motor system in the brain somewhat back into a sense of balance.
Patient experience at Houston Physicians Hospital is top-notch, shown in their recent CMS award, one of only 2 hospitals earning a 5-star rating. And patient navigators are assigned to each patient to help make the process seamless. To learn more about Houston Physicians Hospital or to book your appointment today, head over to houstonphysicianshospital.com.
So here we are. Has anybody ever gone through the LSVT BIG or LOUD program? I know a few have or are currently undergoing it. So yes, there's Mr. Phillips. He'll be signing autographs. He was on the video. So actually, let me back up a little bit. Before I go on to talk about that, I do want to give a shout out to Jed here. He's with Medtronics. Do you want to tell him a little bit about yourself or about your company?
Thank you. Appreciate that. So with Medtronic, again, I'm a local representative with the deep brain stimulation division of Medtronic. Medtronic's a very huge and diverse company that I work solely with Parkinson's and essential tremor patients, and even now epilepsy. We just got approved for that as well. So I'm going to be around after the talk. I work with Dr. Bonnen and the whole team here from the Parkinson's service line. And but if you have any questions about DBS, feel free to come by and chat with me. I'll be around. Thank you so much.
Thank you. So as you saw in the video, Dr. Bonnen is one of our neurosurgeons. So we kind of work hand in hand where he can help counteract some of the stuff that therapy cannot control, one of them being tremors. So that's where we would send you over to Judd and his team with Dr. Bonnen to help with the essential tremors or the tremors from the Parkinson's. Come on in. So we just started. You haven't missed much. So as I was saying before, the LSVT BIG and LOUD program, we have started here at HPH, and it's really kind of taken off. I've been doing it for probably over 8 years. We also have Martha here. She's our speech therapist. Wave hello, hello. So we'll kind of go into depth what is entailed in the program. I will tell you I've seen amazing results. I'm a huge fan of it. I'm very passionate when it comes to Parkinson's patients. My grandfather had it, my father has it, so it's something that is near and dear to me. I actually did my thesis on it when I was in grad school, so it's something that, you know, I really hope that we find a cure for. And in the meantime, we'll just keep on trucking and keep treating. So LSVT, there is a protocol when it comes to the LSVT BIG and LOUD. They are both the same. It consists of 16 sessions. That is 4 consecutive days a week for 4 weeks, minimally. It's really intensive. There are individual 1-hour sessions, and we do issue daily homework and then daily carryover task. So LSVT, anybody know what that stands for? I would assume not. That's okay. So it means Lee Silverman Voice Training. So whenever the program started, it started off as a speech component with a patient named Lee Silverman. So they found that it was out of Arizona. They found that whenever they really were emphasized increased amplitude with the speech component, that there was a lot of carryover, that you could hear the Lee Silverman a lot more, and that she just had a better quality when it came to regard with the speech component. So they thought, well, let's see what happens with the physical component. So that's where the BIG comes in. So the LOUD is for the speech and the BIG is for the PT. So they transitioned it over into the physical component by increasing the amplitude of movements. So, okay. So research has been done, of course, on LSVT BIG and LOUD. I've seen it firsthand that these are just some of the things that you will see improved. Definitely a faster walking pace with bigger steps. You'll have improved balance, increased trunk control, improvements in activities of daily living, specifically bed mobility, because that becomes really difficult as the disease progresses, and overall improving your motor score. And the biggest thing would be quality of life. I cannot speak enough about this. That's my major component for doing what I do, is I want to improve your quality of life. I want patients to be able to do the things that they love to do. So that's one of the first things I ask when I have an evaluation. What do you have problems with? What do you want to improve with? Because if you're interested in it, then chances are you're going to participate a little bit more, and then you're going to have an improvement with the therapy. A huge component on what is salient to you guys. What makes you tick? So this is a patient of mine. And I do this with all my patients, so if you've come to me before, I've already taken a video of you. Don't share it unless you give me permission. But with this gentleman, this is the initial visit, and we're doing what's called a TUG. And a TUG is an assessment that we do in therapy. It stands for timed up and go. So it's about 10 feet, and we time how long it takes you to complete that task. So it's from standing up, walking 10 feet, turn around, walking back, and sitting down. So that's an indication for us on who is a fall risk. Anything above 12 seconds, we consider you a fall risk. So I like to use it as, number one, an assessment tool to see if you're a fall risk, and number two, to see how you move. So I like to do a before and after. So this is day, and it's going to show the before and after. So you'll see. And one of our IT guys made it all fancy. So day one. So lots of shuffling, very characteristic of a Parkinsonian gait, Parkinsonian walking pattern. And he does the same thing on the other side. So his tug time here is 39 seconds. So that means he's a really high fall risk at this point, right? Extremely high. And you can see he's having lots of freezing episodes. Can you imagine how high of a fall risk he is? Pretty high, right? Okay. This is after the program. This is actually 2 weeks into the program, but we'll say after. So there, it was a huge difference. So there was a huge difference, not only in his quality of life, he was able to move better, and we reduced his fall risk. So I've seen it, these particular exercises work wonders for patients. So again, just making them feel better, move better, reducing the fall risk, improving their quality of life, so on and so forth. In a second, I'm going to talk a little bit about the boxing program that we have. but exercise is the only known factor to slow the progression of Parkinson's. So it's huge to treat, to participate in therapy. And this is where, like, educating the neurologist from my standpoint is a huge component for me, because a lot of times the neurologist will see like a high level Parkinson patient. Oh, you just received the diagnosis. Well, you look pretty good, just exercise. Well, I would say that as soon as you receive the diagnosis of Parkinson's, you need to see a therapist ASAP, no matter what level of fitness you're in. Because we can provide those tools for the future, give you that education component on what to expect, because this is a progressive disease. So we want to slow that progression as much as possible, provide lots of education, and let you know what to do for the future whenever it starts to affect certain things. Most of the time, when you think Parkinson's, you typically only think the physical component. I know poor Martha kind of gets shoved to the side a lot of times. And my first question is, how's your swallowing? Because it's pretty important. People like to eat. I like to eat, of course. Everyone loves to eat. However, with Parkinson's, sometimes the throat muscles are affected. So it's one of my number one questions that I talk about up front, because it's very dangerous. If you aspirate, it's very deadly. So that's one of the first conversations I have. My grandfather, that's actually how he passed away. So I'm very upfront about it because it's very serious. So also, oftentimes, like I said before, they'll come to me for the PT part only. We may start the sessions and then I start to notice, okay, are you having troubles carrying over what I'm asking you to do? Do you have some memory deficits? Do you have trouble following directions? Or can I hear what you're saying? I'll go back to my grandpa. He was a huge jokester. No clue what he was saying half the time. I just started laughing when he would laugh because it was really hard to hear him. So, I really wish that I would have known about this whenever he was alive, because I feel like I could have made such a difference. So, and oftentimes, I tell Martha, like, hey, this is kind of what, I'm not a speech therapist by any means, but this is what I'm thinking about the patient. Let me know your thoughts. And then we work really well together. The neurologist, oftentimes, if I ask for a speech consult, they almost always give it to us. She does all memory, cognitive, swallowing, speaking. And then we do have a little video clip. This is a patient who went through LSVT LOUD. She's not our patient, but it's on their website.
Have you noticed any changes in your speech or your voice that you would associate with Parkinson's?
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Uh-huh. Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say ah for as long as you can.
Ah.
Good for you. Okay. Would you say Parkinson's disease has caused you to talk less?
Yes.
Because?
Because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. Till I get mad and then yell.
Take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of the Pioneers one of these days with my voice.
Good for you. That's excellent. What practicing do you do at home?
My ahs, my highs, and my lows. And I read out the mail out loud.
Excellent. Do you feel like practicing helps?
Oh, yes.
Okay. Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "What? I can't hear you."
Good for you.
But I think he does that just to be cute.
I think he does too. Has anyone commented that it's easier to understand you now?
Oh, yes, I set some of our friends back when we went to their house and I talked loud. Lou says, "What the hell happened to you?" My daughter said, "Oh, Ma, that's you?"
Isn't that good? Don't you feel wonderful?
Oh, yeah, because now she can't say, "I didn't understand what you said."
Right? No excuses, right?
Yeah,
That's
no
right.
excuses.
All right. So what do you do when you want to be as easy to understand as possible?
Think loud.
So this brings us to our next point. We just launched this this past week, and it was super exciting and fun. I'm sore. So, and I know a few of the patients are probably sore too, but we just started our Rocksteady boxing program, and it's actually in this church right here. We do 2 days a week at 9:30, and then hopefully we continue to build and can expand from there. But I will say it's a great workout. We'll get to it. Okay, so the story behind Rocksteady Boxing was founded in 2006 by actually in Marion County by an Indiana prosecutor named Scott Newman. He was diagnosed at the age of 39, really young onset of Parkinson's. That's not as common. However, he started noticing that when he was training like a boxer, of course, non-contact, we don't want to get hit, that might make things worse. But when he started training like that, he noticed that his Parkinson-like symptoms decreased. And so it was initially intended for the young onset of Parkinson's. However, they noticed that let's just do this for everyone, so even the geriatric population, because that's more typical to have the diagnosis of Parkinson's after the age of 60. So they just carried it over, and it quickly spread. And there was a study on ESPN that basically found out that the high intensity exercise, specifically boxing, was the most high intense that recruited the most amount of muscles in the human body. So it's a really great workout for Parkinson's patients. And that's the beauty, is that it is for Parkinson's. And I keep saying patients, and I got to get out of that habit, because when you're in Rocksteady Boxing, we don't call you patients, we call you fighters. Okay, so that's the thought, is that you're a fighter. So right now, I think that they've even gone up since then. The current affiliation numbers, there's 545 total affiliates that are a part of the Rocksteady program, with 517 of them being in the US. So it's pretty exciting. So this is just something I kind of went over a second ago. Forced intensive exercise is what's really going to make a bang when it comes to Parkinson's symptoms. So the study was, they had two individuals on a bicycle. One got to control her speed and just, was exercising every day, but it wasn't a high intense. I see this all the time when in the therapy sessions, when people say, "Oh, well, I work out, 5 days a week," or I've been to therapy before, and it's like, well, that's great, but tell me a little bit about what you've been doing. So they show me the exercises. They're great exercises. They're great orthopedic exercises. However, Parkinson's is not an orthopedic problem. It's a neurological problem. Parkinson's is not a muscular degenerating disease. It's a neuromuscular disease. It turns into a muscular problem when you start to find things become really difficult to do, like when you have a tremor, or when you start to freeze, or when you're shuffling, or those turns become really hard. That's when you just sort of stop moving. Or maybe you don't like going out to dinner because you don't like tremoring and you have trouble cutting up your food. You don't want somebody else to cut it up for you. Then you start to become more reclusive, and then it turns into a muscular problem. So with the Rocksteady Boxing and the therapy program, our goal is to get you moving and go out and do those things, because we know that when you're more active, you're slowing the progression of Parkinson's. And then, the biggest thing is you're improving your quality of life. So, all right, so we do know that the boxers train to improve balance, hand-eye coordination, speed of movement, agility, muscle power, mental focus, and rhythm. One thing that's not on there that I think we should add is the speech component. That is a part of the Rocksteady Boxing too. We do a lot of chanting. There's a lot of camaraderie. We do encourage you to yell, to holler, to sing, all those sorts of things, because that's going to improve your diaphragm, it's going to improve your lung capacity, and then it improves your speech. And as Martha said earlier, speech is very linked to swallowing. So we want to combat that. So I think that's something I need to go ask. Let me add that too. Plus, it's fun to tell your grandkids you're going to go box, right? You get some boxing gloves, you get to hit some things. When I first pulled out we call him, I don't know what we've named him yet, Bob,
or
he's the mannequin guy that you get to punch. It's really fun, really fun. I had my daughter help us set up. She's 14, going on 30. So I had her help us set up the boxing equipment. And the first thing she did was like, I want to hit that. And I was like, yeah, do it, hit it. So it just feels good. And you know, you get to take out some stress too. So it's super exciting. Basically, there's a fight in all of us. Every workout is diverse. It's not like the previous one. It treats all levels of Parkinson's. You can do it from a wheelchair. If something's too hard in standing, we can sit you down and do it. I will tell you, we're going to challenge you to the max. Tuesday, this is so funny, one of our boxers, we were doing an exercise, like a punching exercise, and you can tell he was exhausted. And I was like, we can do this in sitting. And he just kept going, no, I'm good. I'm good. I'm good. And I'm like, sit down, sit down. So, but it's okay. If you fall, we just get back up. That's the beauty of it, is it's okay. You can hit the ground. You're still going to get up. And we haven't gotten to this yet in our class, but we teach you how to fall. We do know with Parkinson's being progressive that falls are inevitable. They're going to happen. There is a good way, if you will, to fall so that you reduce your amount of your risk of injury with falling. So, okay. So like I said, we treat all Parkinson's, all levels, with tough love. My dad told me this past week. What did he say? He was like, we all agree that you're a meaner therapist. Oh, well, like, you love me anyway. So, and that, you know, I take it serious. I like to have fun, but I also see that doing that tough love gets patients where they need to be. If I make it easy, chances are you're not going to be as successful. So yes, I'm tough, but I do it with some love. A little thing about the bottom part, we do perform an assessment on each participant before they join the program. Ashlyn back here is one of our coaches. She's like my right hand. She is wonderful. She is also very big in our Parkinson's program. So we make an appointment for you I would say maybe 20 to 30 minutes it takes for the assessment. And this is just to determine your fitness level. When we start expanding our classes, we like to divide it based off of fitness level, so that we really challenge every single person. So, okay. Millions of dollars are allocated each year to the Parkinson's Foundation for finding a cure. You know, until that happens, as I said before, we're going to keep on trucking, keep fighting. I will encourage you to be educated in this field. I had a patient in the past who the neurologist told the patient that basically there was no funding for Parkinson's, there was no ongoing research and to deal with it. Do you know how mad I was? I was livid. Not to speak ill, but it was like, find a new neurologist, you know, very quickly. So, you know, there's always ongoing research. You know, we want to find a cure, as bad as those who have Parkinson's, you know, and it affects the family as well. So keep on pushing. So that's basically it. Come on, fight with us. If you have any questions, I put my cards at the front. If any of you guys are interested, we can set up an assessment for the Rocksteady program or for therapy. Rocksteady is not covered by insurance, but therapy, of course, is covered. One of my biggest reasons for wanting to implement the Rocksteady program is because we all know patients are not the greatest at doing home exercise programs. So that's what I was running into as a therapist. I would see a patient and I would see them outside of therapy. They had already completed, they did amazing in my course, and then maybe I'd see them, I don't know, a few months later and back to doing smaller movements. They didn't have as much carryover. They still looked pretty good, but not where they needed to be. And so I thought, what can I do so that the clients continue that upward stride, you know, not backsliding, because we're going an uphill, we're fighting an uphill battle. So that's why I decided to do the Rocksteady program, because at least if you go through therapy, I have something to say here. This is to help keep you moving. So I'm super excited about it. Just started, but anybody have any questions for me? Yeah.
Just something I want to add to. So, you know, kind of adding on to your comment about investing in Parkinson's and research and development, our company alone has invested $300 million in 3 years towards the advancement in next generation products to help treat Parkinson's. So, that's your point. There is a lot going into it and a lot of research. So, we're very excited about that.
Definitely.
Yeah, there's a lot going on. And not only that, but pharmaceuticals too.
Yep, for sure. And I will say, to add to that note, with the pharmaceutical aspect, I know that sometimes medications are not always the funnest to take. Research does show if you exercise, you may be able to reduce the amount of meds you have to take for your Parkinson's. So just something to keep in mind. Like, it's always beneficial to exercise and to keep moving. Okay.
How many medicines are there to deal with tremors?
I am probably not the person to answer that. So I would ask the neurologist, your neurologist, because I know that there are a few different types. I don't know all the types, and then it's going to depend on what your reactions are with, what reactions you have to that medication, what medicines you're already on, and that would fall more under the physician's scope of practice.
Well, the medicine is worse than the disease.
Sometimes what I have heard from neurologists and patients is there is like an adaptability area, so to speak. So sometimes it can take time for your body to become acclimated and strides, so sometimes like you might feel not so great in the beginning, but over time you start to become acclimated and then it starts to work. So that is something to keep in mind. I know it doesn't feel the greatest in the beginning, but if we exercise, maybe we can reduce how much you have to take, and then figure out what works best for you. And sometimes you might have medicine and it might be too much. You might need to back down some, or maybe it's not doing its job because you're not taking enough. It's kind of a trial and error. Comments, concerns? Sure.
The high intensity training, does strength training help for Parkinson's?
It does, and I will tell you that that's kind of all encompassed in the Rocksteady program. But there's definitely a lot of strength going on. I'm really sore. really sore. So yeah, and we do have some specials going on right now. So if you're interested, we can talk after everybody's dismissed here. I do have a card up front, and we have some brochures over the Rocksteady program as well. So, but yeah, strengthening is definitely a part of it. We do, I would say, not like a ton of like weightlifting, but we do have, like this past week we used medicine balls, but a lot of body supported. Like we had the boxers doing planks and push-ups and sit-ups and Supermans, and you're hitting a boxing bag that's pretty heavy too. So all sorts of stuff. It's a good workout. Okay.
Great.
Any other questions? We're all good? Well, thank you guys for coming out.